If you or a loved one is living with cancer, you probably have two focal points: how to rid yourself of it and how to prevent it from coming back. You'll get some terrific information today on Cancer Concepts and Complements with Dr. James Belanger. We'll explore natural medicines which may enhance conventional therapies, share cutting-edge research, and offer insight on how diet and natural medicines can play an important role in treating and preventing cancer. The information presented herein is in no way intended as a substitute for medical counseling. Now, here is Dr. James Belanger.
Good morning, everybody. Welcome to Cancer Concepts and Complements. I'm your host, Dr. James Belanger. Thanks for joining me today. The purpose of this show today and the next 13 weeks is to help you, the listener, gain a better understanding of all the published research that has been conducted on natural medicines all over the world, natural medicines and cancer all over the world. And I want to share with that so you can, if you're a patient or have a loved one, that you start to understand that there is research on natural medicines and cancer. It's a common statement that I hear from patients saying that their doctor, their MD, said that there are no studies on natural medicines and cancer, and to not waste your time and change your diet or take any supplements. And I want you to know that that is simply not true. There are many studies, and that's the whole purpose of the show, to get you familiar with that. And I do all my research on this website. It's called PubMed.gov, PubMed.gov. That is the National Library of Medicine's National Cancer Institute. All the published research on all kinds of things from chemotherapy, radiation, and natural medicines are on that website. Peer-reviewed medical research published in journals. And so over the next 13 weeks, I'm going to talk about how natural medicines can enhance the effectiveness of chemo, make it work better, reduce side effects, help make radiation work better, hormone therapies like tamoxifen and aromatase inhibitors, help make targeted cancer therapies work better, like if you're on Tarceva, for example, or Herceptin, Lapatinib, all those different targeted cancer therapies. There are natural medicines that have even been studied to possibly make those work better. I'm going to talk about natural medicines that inhibit blood vessels in tumors. That's a whole new set of research being conducted. They call them anti-angiogenesis inhibitors, or things that inhibit blood vessels in tumors. There's even natural medicines that have been studied in animals where they give these natural compounds and it causes cancer cells to die. So it's kind of like natural medicines that may act like a chemotherapy. And then we're going to talk about the lab. I have a background in laboratory medicine, and there are various laboratory tests that aren't being conducted in patients that can help analyze and identify weaknesses in a person's immune system, and then talk about how to use this information to construct a treatment plan of natural therapies that can help correct imbalances in the immune system. The laboratory plays a big role in helping me formulate and put together a treatment plan for people. But before I get started, let me tell you about myself. So my name is Dr. James Belanger. I like to pronounce it the French way. And I am a naturopathic doctor. And I'm also a medical technologist. I have a degree in laboratory medicine. That's my bachelor's. So I got my doctorate in naturopathic medicine in 1998 from a school called Bastyr University. It's out in Washington State. It's one of many accredited naturopathic medical schools. And I got my bachelor's degree in medical technology, which is the laboratory degree, in 1994 at UMass in Lowell. And I practiced in Lexington, Massachusetts. And my wife, Dr. Karen Braga, is also a naturopathic doctor. We went to school together and have our own practice here in Lexington, Massachusetts. If you're not familiar with that term, naturopathic doctor, let me explain what that means. Naturopathic doctors or naturopathic physicians, we have this, our abbreviation is ND. Instead of MD, it's ND. And we are specialists in complementary or alternative medicine. I prefer the term complementary because it's good for complementing the conventional medicine, not necessarily as a complete alternative always. And I'm going to talk about how it's going to complement the cancer treatments. But if you have questions about vitamins or diet or herb, the naturopathic doctor is the specialist on that, not the MD. They really don't have that much training in that unless they did some extra training. The osteopathic doctor might not have a lot of training. The nutritionist is trained in a lot of the diet part, but the naturopathic doctor is a doctor who specializes in herbs, diet, nutritional supplements, homeopathy, that type of stuff. And they have to have a bachelor's degree just to even get into a naturopathic medical school with the same pre-med requirements that an MD does. You have to have, biology and chemistry, physics, all that. You have to attend then a 4-year graduate level naturopathic medical school and then pass a rigorous professional board exam. So it's the same type of thing like an MD. You have to have a bachelor's, then you go to a 4-year medical school, pass your board exams, and then you are an official ND, and then you become licensed, start practicing, and do some residencies and things like that. There's only about 7 naturopathic medical programs right now in North America. I went to one school called Bastyr University in Seattle, but there's also one in Portland. There's a school in California, in Bridgeport, Connecticut, a couple in Canada. And so that's where the programs are. And like I said, naturopathic doctors are educated in the same clinical sciences as MDs and the basic sciences. So we had to take anatomy classes and physiology classes and biochemistry. But then we also took specialty classes like oncology and gynecology and neurology. But all throughout that 4-year program, we're not only learning about the drugs, pharmacology, but we are also learning about clinical nutrition, diet, and nutritional supplements and how those can be integrated to help people with various diseases and cancers and stuff like that. We learned about homeopathy, which is I won't really explain. It's too much to go into, but it's another form of natural medicine and herbal medicine. So we learn about all the different herbs that can help people. And we're learning about the science, too, not just the historical uses of some of these herbs, but the current science that has been published on it. We're licensed in 17 states right now. It's not every single state does not license naturopathic doctors. If you're in one of those states that might not have heard of them, that might be one of the reasons. And we're also licensed in the District of Columbia, Puerto Rico, and the Virgin Islands. If you want some more information, you can certainly go to my website, which is www.lexingtonnaturalhealth.com, lexingtonnaturalhealth.com. And then there's the American Association of Naturopathic Physicians has a website, which is naturopathic.org. And you can read more about the training of a naturopathic doctor, the schools, the philosophies. I decided to go into naturopathic oncology after being a cancer patient myself. In 1990, I was diagnosed with testicular cancer, and I needed 3 surgeries to basically get the cancer out of my body. It was stage 1, but it took 3 surgeries to determine that it was stage 1. And then I was instructed to come back every 3 to 6 months for a few years and have blood work and CAT scans to see if the cancer was returning. I didn't have chemotherapy, but they said if it came back, I would need chemotherapy. Chemo does work very well for testicular cancer. You'll learn that it unfortunately doesn't work very good for a lot of other cancers. But testicular cancer, it actually has a high cure rate, which was something that comforted me if I was going to need the chemo. I never did need it, though, thank God. And I was not too keen on having to need chemo because chemo for a young guy like myself at the time can increase your risk of leukemia later on in life and infertility, and I wanted to have kids. And so I asked the doctor, is there anything I can do to keep the cancer from returning, like, change my diet, strengthen my immune system, so I didn't have to need chemo in the future? And the doctor said firmly, no, there's nothing you can do. The cancer's either going to come back or not. And, I refused to believe this. Prior to the cancer diagnosis, I was already taking pre-med courses. I was actually on a path to become an MD. I was working as an EMT, on the ambulance, nurse's aide. I was working in rehab. I even spent time shadowing an oncologist because I was interested in cancer even before I had cancer. And then I was going to start studying nutrition. I was going to go back to school and start studying nutrition, but then the summer of 1990, I was diagnosed with the testicular cancer, and that kind of stopped plans for a little while. But, I said there's got to be some research on natural things or other things that I can do while I'm waiting, not just keep coming back in for blood work and CAT scans and hope they got it all. Cancer doesn't just turn into a tumor overnight. There's a series of steps, which I'll talk about in one of these programs, of how cancer starts to form into a tumor, how it evades or avoids being detected by the immune system, how it grows blood vessels, how it spreads to the body. And they know about a lot of that stuff. There's published research on all these things. But unfortunately, there's very little medicines that are approved for people that are, in this point that I was, where they're done with the treatment and they're just kind of watching and waiting. If you have breast cancer, you go on tamoxifen or aromatase inhibitors. But a lot of other cancers, after they cut it out or chemo or radiation, you're just kind of left to watch and wait and hope that they got it all. And like I said, there is research on things that could help make your immune system see the cancer and respond to it better that are available in health food stores. And then there are dietary changes that have been shown to help reduce the risk of getting a reoccurrence too. So we'll be talking about that. After my cancer diagnosis, I switched my major to laboratory medicine. I was doing biology at UMass in Amherst, Massachusetts, and then I switched to laboratory medicine to gain a better understanding of laboratory tests that can help identify immune imbalances. And then I met my wife and at UMass Lowell in Lowell, Massachusetts, and she introduced me to naturopathic medicine. And it was a perfect time because I was already thinking of nutrition. I was thinking of, acupuncture. My brother knew a woman who said that her seizures went away after starting acupuncture. I'm like, wow, that's really interesting. I want to know about every type of medicine out there. I don't want to just learn about drugs. I didn't think there was a school that did that. And so my wife, said, there's the doctor, calls him a naturopathic doctor in a nearby town. Why don't you go and visit him? So I go visit him, and he shows me the curriculum of one of the schools, the school I ended up going to, Bastyr University. And I was impressed with the great diversity of classes in nutrition, and herbal medicine, Chinese medicine, homeopathy. And then there was all those basic science classes, the chemistries and it's been a while now, so I forgot, anatomy, physiology, and then the clinical sciences, like you said, the oncology, the gynecology, all in one roof, and pharmacology classes. And then there's rotations in the hospitals and in different clinics where you're learning. And there was MDs also on staff there, naturopathic doctors, chiropractic doctors. And that's exactly what I wanted. And then you can even learn Chinese medicine in a lot of the programs to understand that aspect, acupuncture, and it was just great, all in one roof. And so, basically after being diagnosed with cancer, I decided to switch paths, and I went off to naturopathic medical school, graduated in 1998, and headed back to where I was from, Massachusetts, and started a practice. So if you or a loved one has cancer, I want you to know that conventional therapies are not the only form of medicine that can help you. There are some very powerful natural medicines that could complement, and I'm not saying as an alternative or a replacement, but that can complement the conventional therapies and support your body in helping strengthen its own healing abilities. So that's what we're going to talk about throughout this next 13 weeks. But today's topic is going to be on natural medicines which enhance the effectiveness of chemotherapy. Chemo is certainly a big part of treatment for cancer right now. And like I said, it works well for certain cancers. It can cure many patients with testicular cancer and certain types of leukemia and lymphoma. But many of the stage 4 common cancers that are today, like lung cancer and colon cancer and pancreatic cancer and stage 4 breast cancers, unfortunately, are very infrequently cured by chemotherapy. And for example, if you have stage 4 non-small cell lung cancer, the first regimen they usually put you on is carboplatin and a drug called Alimta. The cancer shrinks about 50% of the time, 50% of the patients, but that shrinkage doesn't last forever, unfortunately. And then within 5 to 7 months, it starts growing again, and then there's another chemo and another chemo. And there are natural medicines that can make that work better. so that possibly a greater percentage of people can respond to it and have a longer response time. And then there's natural medicines that help the immune system and stuff to also help keep the cancer from returning. You don't want to totally depend solely on the chemo to do all your work. If you have colon cancer and that has, unfortunately spread to the liver and it's pretty diffusely throughout the liver, that's considered stage 4 colon cancer. The typical treatment is FOLFOX or something called FOLFIRI, different types of chemo. And, most of the time, only about 30% of the patients respond to those where they get some shrinkage. And then that shrinkage lasts about 7 months is what the published research says. And then it starts growing again. Stage 4 pancreatic cancer has even worse numbers. And so I encourage people to see a naturopathic oncologist and start a naturopathic program to help make the chemo work better. And if you're concerned about, any negative interactions with chemo, this is a legitimate concern that needs more studies. But, unfortunately, if you're facing those odds that I just said, we really can't wait. You can't wait for the studies, unfortunately. And so I want to present to you at least some of the research that's being done. A lot of it's in animals. There are some small human studies to help you make at least some educated decision on what could be paired with the chemotherapy, with the guidance of a naturopathic doctor and your MD to help maybe improve those results that you're going to get from that chemotherapy, to reduce the side effects, make it work better, and make it work for a longer period of time. But we're going to stop right here for the moment and take a little short break. And this is Cancer Compliments and Concepts. I'm your host, Dr. James Belanger. And then coming up next, we're going to go into all the mechanisms of how cancer becomes resistant to chemotherapy and how we can stop that with natural medicine.
This is Cancer Concepts and Compliments with Dr. James Belanger. The information presented herein is in no way intended as a substitute for medical counseling. If you would like to find out more about the Lexington Natural Health Center, please visit lexingtonnaturalhealth.com. That's lexingtonnaturalhealth.com. Now, back to this week's program.
Welcome back to Cancer Concepts and Compliments. I'm your host, Dr. James Belanger. Before the break, we were discussing how natural medicines can help enhance the effects of conventional chemotherapy. And we were talking about, unfortunately, some of the poor statistics on chemotherapy when you have stage 4 cancers like colon cancer and breast cancer and ovarian cancer and stuff like that. And today's show, we're going to talk about the research that's been done on natural medicines to help possibly make chemotherapy work better. And this is a concern that a lot of people don't want to mix herbal and nutritional supplements with chemotherapy, and the oncologists aren't often very keen on that either. And I really wish that there was more research where it was more clear-cut. But I just want you to know that one thing I do before I prescribe any kind of nutritional supplement for a patient is I look to see if there's been any reported interactions with that conventional therapy and that natural medicine. And then I also look to see how that drug was metabolized, how that chemotherapy is metabolized by the liver, and if any of those natural medicines that I'm thinking of interfere with the breakdown of that chemotherapy, or allowing it to either stay in the system longer or to break down more quickly. So that's how I make my decision on how to pair things with it. Because, like I said, we really, if you have those stage 4 cancers, it's really, a good idea to start pairing things because, the chemo, unfortunately, has not been shown to be curative many of the times. And we have to go into a little gray area and add things to make that chemo more likely to work. But do it where, at least there is some research to back up the decisions. It's estimated that if you have a 1 centimeter tumor, that 1 centimeter tumor contains 1 billion cancer cells, just in a centimeter tumor. And about 100 of those 1 billion cancer cells can be resistant to chemotherapy even before being exposed to chemotherapy. And then after 1 dose of chemotherapy, more cells can gain resistance. If the tumor is bigger than a centimeter, or you have many 1 centimeter or so tumors, and there's more than 1 billion cancer cells, and there's more resistant cells in there even before being exposed to chemotherapy. And like I said, after one dose, resistance happens. So that's why it's extremely important to find things that can stop these resistant mechanisms from happening, so that the chemo will have better response rates, shrink more of the cancer, and cause it to stay at bay for a longer period of time. And that's what, testicular cancer for some reason seems to be very sensitive to chemotherapy, and some lymphomas and some leukemias, whereas a lot of the solid tumors like the colon and the breast and the pancreatic and the ovarian are not as sensitive or gain resistance over time. So there's at least 5 different mechanisms that researchers have found of ways that cancer cells become resistant to chemotherapy. And so we need to talk about all those different mechanisms. But before I describe the different mechanisms, because it is kind of complicated, trying to think of an analogy that might help you understand it better. So one analogy that seems to fit pretty good is the analogy of the steps you take to keep water out of your basement. Okay, so you're I don't know if you have a basement wherever you're listening, but in Massachusetts, basements, water coming in the basement's a big issue. And so a lot of people will try to divert the water away by creating a trench or something to help slope the water away from their foundation. So that's one mechanism. Or we'll have these sump pumps, a couple pumps in the basement, sometimes more than one, to help pump the water out. And then if the water does come in, a lot of people have the vacuums to vacuum up the water. And then if the water, you can't vacuum it up, you put your furnace up high so that the water won't touch it. And then you fix the furnace if it does get busted and stuff like that. So that's kind of what cancer cells do, is they will create you could call it a trench or a barrier around themselves, just like you create a barrier around your house to keep chemo from even getting to the cancer, to keep it out. They call that barrier the tumor stroma. And pancreatic cancer, for example, which is very resistant to chemo, has a large stroma around it, a barrier around it to even keep the chemo from even getting to it. Then the thing about the analogy about the pumps. Even if the chemo does get through the stroma, or the cancer doesn't even have much of a stroma, and then the chemo starts to enter, cancer cells actually have pumps on their surface cell membranes, just like you have a pump in your basement. And cancer cells might have a couple pumps, not just one. And so if the chemo does come in, the pump basically takes the chemo and shoots it back out. The chemo will only harm the cancer if it stays inside the cancer and interacts with the DNA of the cancer. So if the cancer has pumps on its surface, it will pump it out. And that's another mechanism of resistance. It might not happen the first dose of chemo, but over time, after the first dose, many of the cancer cells that survive the first dose will create more pumps on their surface, overexpress them so that they have it. Just like if you have water coming in your basement and you never had a pump, before the next rainstorm, you go out to the hardware store and you get one. That's what the cancer cells do after they've been exposed. If they happen to survive that first dose of chemo, they'll go out and they'll make more pumps to help get prepared for the third dose or the second dose. And the third mechanism of resistance to chemotherapy is if the chemo does get inside and it's not pumped out, the cancer neutralizes the chemo. And this is like the analogy of vacuuming up the water if it comes into your basement. So the cancer cells will neutralize it. There's something called glutathione. It's a compound made in cancer cells that comes in contact with some types of chemotherapy like cisplatin or oxaliplatin, some of those drugs, and doxorubicin or adriamycin, and basically kind of prevents it from creating any damage. You could think of it as neutralizing, like baking soda neutralizes vinegar, or like you just sucked up the water so it won't damage your furnace. So that's cancer cells will start upregulating this thing called glutathione after one exposure to some of these drugs like the platinum drugs, and that will cancel it out. There's also something called Metallo Thiamine, which is something that cancer cells can also make in response to drugs like the platinum drugs, and that also neutralizes or binds them and prevents them from damaging that vital DNA of the cancer cell. So that's a third mechanism. Then a fourth mechanism. So say, there were things done to allow the chemo to get there to the cancer, breaking down that stroma. Then there were things that were added to help stop those pumps from the cancer. So we dealt with that part. And then we also dealt with this thing called glutathione, preventing the neutralization of the chemo. Now the chemo starts to work its way to the nucleus of the cancer cell where that DNA is. That's how chemotherapy works. It either creates some kind of damage to the DNA of the cancer cell, or it prevents the replication of the DNA, or it prevents the actually dividing in half of the cancer cell. So the mechanisms come down to some part of the cell division pathway. Well, just cancer cells can sometimes not even go into a DNA replication phase. They can keep themselves out of that replication phase to keep them from being sensitive to chemotherapy. So there's ways that you can, get the cancer to go into the state that it's most sensitive to chemotherapy. I'm going to talk about that. So you could think about it with the analogy is that, okay, if you happen to have water damage in one part of your basement, you take and you move the furnace to a different spot that tends to be drier. If the cancer is in a certain state, if its DNA is a certain state that is very susceptible to chemotherapy, it will put itself in a different state that is not as sensitive to chemotherapy. It will change its DNA and wrap it up like a ball of yarn to keep it protected from the damaging effects of chemo, and then it becomes resistant that way. Okay, the analogy is said, okay, so say the water does damage your furnace. All the efforts you did to prevent it from harming your furnace failed. Well, you get a new furnace or you fix the furnace. And that's what cancer cells can do as a fifth mechanism of resistance, is they repair their DNA. And so there are all kinds of compounds that are being studied that could possibly prevent the chemotherapy from damaging or from the cancer cell from repairing the DNA. So preventing repair. And then the sixth mechanism of resistance to chemotherapy is even sometimes that the cancer cell has been damaged and it did not repair. I like to call it like a life support system. Cancer cells have a life support system that prevent it from dying, even if it has been damaged. And they call that anti-apoptosis, or inhibiting cell death. So that is something that we need to talk about as well. Okay, so let's expand on the resistance mechanism number 1. So like I said, cancer tumors have mechanisms in place that help keep chemo from even getting into the tumor cells. Just like we have mechanisms in place that keep the water from even getting into our basins in the first place. And that is the formation of the tumor stroma, the barrier around the cancer. And some cancers, like pancreatic cancer, have a very large tumor stroma, which is something why they're so resistant to chemotherapy. So how does this tumor stroma form in the first place? Okay, well, blood vessels are supplying tumors. And in order for a tumor to get bigger than a few millimeters, it has to make more blood vessels. And so it makes them pretty rapidly. But the blood vessels of tumors are not the same as normal blood vessels a lot of the times. They tend to be thinner walled, and they leak more. They don't have the normal structural components in them that keep them thicker walled. So it's like a hose with a bunch of holes in it, and it leaks all over. And in our blood are different proteins. And there's this protein called fibrinogen. Fibrinogen is a protein in our blood, and if it leaks out of a blood vessel, it then gets converted into something called fibrin. And fibrin is deposits around the cancer. The same thing happens in a wound. So like if you cut yourself, the blood vessel will leak because you cut the blood vessel. The fibrinogen that's in the blood leaks out of the blood vessel and then gets converted into stuff called fibrin. And the fibrin binds red blood cells and platelets and forms the clot. So they talk about the cancer is very similar to wound healing in that it does activate the clotting system, and there is this product of the clotting system called fibrin, which happens to be generated around the cancer and is a component, not the sole component, but a component of the stroma. And so we're going to talk about natural things that help break down this fibrin and help chemotherapy penetrate better. So the fibrin that starts to deposit around the cancer creates pressure on these thin-walled blood vessels, and the blood vessels start to collapse in the cancer. And so when blood vessels start to collapse in the cancer starts to be becoming deprived of some of the oxygen that's in the cancer. And then the nutrients that are in the blood are also not getting to the cancer. So the cancer becomes nutrient deprived and low in oxygen. And this causes some of the cancer cells that are not getting enough oxygen and nutrients to start to slow down their growth rates, their proliferation rates. And chemotherapy tends to affect cells that are growing rapidly. And if the cancer cells are not really replicating much, they're still alive, but they're kind of in almost like a hibernation. The chemotherapy won't affect them. And then when you're finished with chemotherapy, for example, those cells can then come out of their hibernation state and start to replicate again, and those are the ones that tend to come back. Or those are the ones that are resistant, and they're still growing slowly, but not as rapidly, and a lot of chemotherapies can't get to them. So mechanism number one would be to try to make those blood vessels not so leaky. If they're not so leaky, this fibrinogen stuff won't leak out, and it won't deposit around the cancer, and then it won't cause the blood vessels to collapse, and then it won't cause this nutrient deprivation and oxygen deprivation. So there's been a handful of studies on natural things and even drugs that might help improve blood flow to the cancer, because that's what the chemo is traveling, it's through the blood. We want good blood flow. We want it to be able to get to the cancer, and we want this barrier in the way. And what's interesting, there's a study that was done in this journal called Frontiers of Oncology in 2013, where this Dr. Lin from China, it was an animal study, but they took the animals and they reduced their calories by 30%. And they gave the animals non-small cell lung cancer. And they changed the diet for about 18 days, and then they killed the animals and looked at the tumors, and they found that the blood vessels in the group that had fewer calories were more mature, that the blood vessels were thicker walled, and if they're thicker walled, they won't leak as much, and if they don't leak, that stroma tends not to form as much, and then chemo can penetrate better. I'm not aware, unfortunately, of a study where they have done what's called caloric restriction, or reducing calories, and then gave chemotherapy. But I know that there is a study being done right now on radiation, making radiation work better, possibly by reducing calories. But that's a simple thing to do. I mean, a lot of doctors say, eat ice cream and fatten up, but that might not be the best advice. That lowering the calories might help change blood vessels in tumors and make chemotherapy work better. There's research also done on ginkgo. We think of ginkgo as an herb that helps with our memory, but the mechanism of how ginkgo might help with memory in part is by improving blood flow to the brain. But ginkgo's been studied for all kinds of blood flow issues, from Raynaud's disease to what's called intermittent claudication, where you don't get good blood flow to the legs, and even erectile dysfunction. So ginkgo has been shown to improve blood flow all over the body. And so there's this researcher, Dr. Hans, in Germany in 2001 that asked the question, will ginkgo make chemotherapy work better by helping to improve blood flow? And so he took a group of patients, colon cancer patients, and, it's an older study. He used 5-FU. Now they pair 5-FU with other drugs, but he used just plain old 5-FU, and these patients were already progressing on 5-FU. And so he continued them on 5-FU, but he then added ginkgo, and he gave ginkgo intravenously. So he adds the ginkgo to 5-FU, and they were already progressing on the 5-FU. And then after 2 to 4 cycles, he did scans to see what kind of response. And 2 out of the 32 patients started having shrinkage again. Remember, they were not responding before, and he just adds one simple thing, Ginkgo. And then 8 out of 32, the cancer stopped progressing over the 2 to 4 cycles. It wasn't a long follow-up. And unfortunately, he hasn't done any more studies, or nobody's done any more studies on this. But that was an interesting thing. Now, you only studied it with 5-FU. I've seen research also being shown that Ginkgo can help make cisplatin work better. So it hasn't been studied with every kind of chemotherapy, and it does have some drug interactions, so it's not to be used with every type of chemo. But 5-FU and cisplatin look like promising drugs to possibly doing more research on the Ginkgo. And it might be contraindicated with people with low platelet counts and anybody on a blood thinner, because it does have some blood thinning effects. But a promising herb possibly to consider. So, we're going to go on break right now and stop here. And when I get back from break, we're going to talk about fish oil and B vitamins like Niacin Amide and improving the responses of chemotherapy. So this is Cancer Concepts and Compliments. I'm your host, Dr. James Belanger.
This is Cancer Concepts and Compliments with Dr. James Belanger. The information presented herein is in no way intended as a substitute for medical counseling. If you would like to find out more about the Lexington Natural Health Center, please visit lexingtonnaturalhealth.com. That's lexingtonnaturalhealth.com. Now, back to this week's program.
Welcome back to Cancer Concepts and Compliments. I'm your host, Dr. James Belanger. Before we took the break, I was talking about natural compounds that can improve the delivery of chemotherapy to cancer. Remember, chemotherapy is going through your bloodstream, and the blood is taking the chemo to wherever the cancer may be. But we've talked about before the break that the blood vessels in cancers can easily collapse, and that cancer can sometimes be surrounded by this network of proteins that are made up of the same proteins that are found in like a blood clot, and that, or a wound, like a scar tissue, that helps prevent the chemo from even getting to the cancer. So there's been some research on Ginkgo in enhancing the effectiveness of the drug 5-FU, possibly by improving the delivery of 5-FU to the cancer. That was a human study. Now there's a study on fish oil that I want you to be aware of. It was done in 1999, a while ago now, University of Texas Health Science Center in San Antonio. This was an animal study, but they basically gave breast cancer to these animals. And then before they started chemotherapy, for just 10 days before, they put them on some fish oil. And then they gave them a drug which is not really used much for breast cancer, called CPT-11. It does have activity, but it's not a common one. It's more used for colon cancer. But they picked this drug called CPT-11, which is also called irinotecan. And they gave 4 treatments. And at the end of the 4th treatment, then they measured to see how much the cancer grew. And it was half the size in the fish oil with the chemo group than the group just given chemo alone. Half the size. And I unfortunately haven't seen a study since on something like this. But the mechanism of fish oil possibly is improving blood flow. Fish oil can help prevent platelets from sticking together. And when the little capillaries that are supplying the tumor, if they're full, the platelets start to stick because of all this fibrinogen, then that might impair the delivery. So fish oil might help it that way. So that's an easy enough thing. Again, fish oil, if you're on a lot of blood thinners, might not be a good thing to be on, but it's pretty benign elsewise, as long as you don't take too much. Too much can have some immune suppressive effects. There's some research showing that more than a tablespoon a day actually suppresses natural killer cells. But this was an animal study. It was about equivalent to 2 teaspoons of fish oil is what they gave the mice, a human equivalent of 2 teaspoons, which wasn't much at all. Okay, so besides, the cancer cells, some issue with the blood vessels collapsing, the cancer cells actually can secrete compounds that make the blood vessels leakier in the first place. And like I said, those leaky blood vessels are what lead to this stroma developing. And there's numerous compounds that they've been studied that cause the blood vessels to leak more. There's something called VEGF, or vascular growth factor. it's responsible also for causing the blood vessels to leak. Then there's something called interleukin 8 or IL-8. There's something called TGF. There's something called MMP9. So there's numerous things that they've found that cancer actually can make, or the cells that surround the cancer can make, to cause the blood vessels to become more leaky, that cause the stroma to form. And so there's research happens to be that like lowering VEGF or normalizing VEGF levels might make chemo work better. Normalizing interleukin 8 levels might make chemo work better. Normalizing TGF levels. So these are some of the things that I actually will test in the blood, because we're going to talk about this in another program, but there's research on testing these things in the laboratory. And if they're elevated, that's considered not a good thing. And there are natural compounds that can lower them, that possibly might help prevent, in essence, the blood vessels from becoming leakier and the stroma from developing. So there's natural things that lower VEGF. And there's a drug, too, a couple of drugs that affect it. There's natural compounds that lower interleukin 8. And so I'm going to talk about some of those in a minute here. But they can be tested. They can be tested in the blood. There's various labs that do them, like I use LabCorp, or Lab Corporation of America is a large lab all over the country that has these tests available. And there's research on them. They're not standardly being done right now because chemotherapy doesn't necessarily target interleukin 8 or TGF. There is a drug for VEGF, but they don't really test for that. They just put people on it or not on it. It's called Avastin, where there is research showing that people respond better to Avastin if they happen to have a high level of VEGF in the first place. And so somebody that has a high VEGF in the blood, that drug would be more indicated. Just like they test estrogen receptors for women with breast cancer, and they put people on tamoxifen or aromatase inhibitors when they have estrogen receptors. You can test these things in the blood and use targeted natural medicines that help reduce these things from the cancer, so the cancer can't use them to make that barrier. So one natural compound, a B vitamin, vitamin B3, called niacinamide, and niacin, has been studied to possibly make chemotherapy work better. And there's actually some human studies being conducted to help make radiation work better that are looking really promising. One of the mechanisms of how niacinamide might help chemo work better is it lowers the production of that thing called interleukin 8 or IL-8. Just mentioned that IL-8 is something that cancer can release that causes the blood vessels to leak more. And niacinamide and niacin, two forms of this vitamin B3, can lower that interleukin 8 production. So I'll test interleukin 8 a lot in patients and prescribe either niacin or niacinamide, and find that works very well for decreasing that. It's not the only thing, but it's one thing that can work for that. Because there's numerous studies that show that patients that have elevated levels of interleukin 8 in the blood are less likely to respond to chemotherapy. Niacinamide has been studied most frequently being combined with this gas called carbogen. So in the research, they have people take niacinamide orally or intravenously, and then they have them breathe this gas called carbogen, which is basically mostly oxygen. It's 98% oxygen, roughly, and then about 2% carbon dioxide. And then they find that that combination together helps improve blood flow and reduce low levels of oxygen in cancer cells. And like I said, if there's more blood flow, the chemo can get there better. A study in the Japanese Journal of Cancer Research in 1997 showed that niacinamide helped increase the concentration of the chemo drug cisplatin in tumors by over twofold when it was combined with hyperthermia. Hyperthermia alone, niacinamide alone, helps somewhat, but the combination was even better. And hyperthermia is when they, heat the tumor or heat the body up. And heat also helps improve blood flow to tumors. And so that they use that with the niacinamide, and the combination worked even better. And they are doing that for some cancers now in the United States, but Germany does a lot of hyperthermia treatments, which looks a lot of promising. More research needs to be done, and that really should be used more in the United States. Another study by Dr. Chen in China showed in 1998 that niacinamide doubled the effectiveness of cisplatin in inhibiting the growth of a sarcoma. Sarcoma is a type of tumor, very aggressive type of tumor in a lot of people, and chemo doesn't tend to work very good for it. Well, cisplatin is a drug that might be used, or a platinum-based drug, and niacinamide was shown to double the effectiveness of it. What's really interesting is you would think, okay, that niacinamide by increasing blood flow might increase toxicity of chemo by improving blood flow to everywhere, but it's actually shown to reduce kidney toxicity from cisplatin. And cisplatin, that's a common side effect, is it's can create kidney toxicity, and niacinamide was shown to reduce that. Niacinamide has also been studied with other chemo drugs like 5-FU. More research needs to be done. It looks pretty promising. It's not free of side effects. I mean, it can cause nausea. It can raise liver enzymes in some people. But as long as that's monitored and there's anti-nausea drugs that can be taken, it looks like a promising agent, and it's very cheap, too. Very cheap. Okay, so besides interleukin-8, we talked about, cancer cells do make this thing called TGF, transforming growth factor. And transforming growth factor is a compound that is a major builder of the stroma. So I mentioned the stroma is a wall that surrounds the cancer. So think of it as like a brick wall. And so it's like composed of, you could think of bricks. And so I mentioned it's composed of this stuff called fibrin and fibrinogen, which are the same things that are found in like a blood clot. But it's also composed of things found in scar tissue, like collagen and elastin and something called fibronectin. And so it's made up of these different proteins, and they're all assembled together. They're all bound together. And this thing called TGF is really a necessary component to help them all like bind together, and it leads to production of a lot of these things like the collagen and this thing called fibronectin and stuff like that. So there happens to be research done that, if a person has high level of TGF, they're more likely to not be respond to the chemotherapy, and that possibly lowering the TGF might make the chemo penetrate better. There was a study done in 2013 in the journal Tumor Biology, where it was patients with ovarian cancer. They were unresponsive to chemotherapy, and they found that they had higher blood levels of TGF than the group that had responded to the chemotherapy. And possible mechanism was that the TGF is needed to form that barrier. And if a patient has a lot of TGF in their blood, there could be forming more of that barrier, and the chemo won't be able to get through. There was a study done in 2011 in breast cancer research and treatment, where they took women that had HER2 positive breast cancer, a more aggressive type of breast cancer, and they put them on this drug lapatinib with Xeloda, a chemotherapy drug, and they found that the response rate, the chemo combination shrunk the cancer in 61% of the patients if they had a low serum TGF. If the TGF was low in the blood to start with, they had a 61% response. But the response was only 17.4% in patients with high TGF. Why? Because TGF helps promote that barrier, and then drugs like lapatinib and Xeloda can't really get to the cancer very well, and so it can't, kill it as much, and so lower response. They also found that the group that had the high TGF, those that did respond, it only worked for about 3.8 months. Versus the group that had low TGF, they had a higher response rate of 61%, and it worked for about 6.5 months. So longer time and a better response rate. So there's many natural medicines that can lower TGF. But one thing that's you hear a lot about in alternative medicine circles is the use of what's called proteolytic enzymes. Enzymes that are found in plants like papaya and pineapple, and also found in pancreas, in our pancreas or pork pancreas, and animals' pancreas. They're like something called trypsin and chymotrypsin. And a lot of these centers say, well, you take these enzymes orally, and they help kind of digest the barrier around the cancer. Well, more scientifically, what they might do is lower TGF production. And TGF is the thing, or transforming growth factor is the thing that allows this stroma to come together. There's this Dr. Desser in Vienna, Austria, who's published numerous articles that you can find on PubMed.gov that shown that taking proteolytic enzymes orally in patients with cancers and other types of conditions reduces the TGF if somebody has a high TGF level. There's been studies done in Germany, just a few, not too many, in the 1990s, showing that patients with lymphoma, myeloma, colon cancer lived longer when chemotherapy was combined with proteolytic enzymes. The most common enzymes that are usually used are enzymes from papaya called papain. There's an enzyme in green papaya called papain. And then enzymes found in pork pancreas, chymotrypsin and trypsin. And then an enzyme found in pineapple stems called bromelain. Those are the ones that have been studied the most, and there's different products that have mixed them together. But it does require a pretty high dose of these enzymes, sometimes like large amounts, 30 or more pills a day, given on empty stomachs in order to encourage blood vessel absorption of them. But TGF is the things that seems to be the major target of these enzymes. So what I do is I check TGF in all my patients. That's available at places like LabCorp. And if a person has an elevated level, then an enzymes would be a useful thing. And then you want to repeat that to make sure that the enzymes are being dosed correctly and that they're at a good level. And if they aren't, there are numerous other things that can lower TGF. Other herbs that I will use are reishi mushroom. There's research showing that this mushroom reishi can decrease TGF, and I find that complements the enzyme therapy very nicely as well. And then there's a form of ginseng that also might help reduce this called Panax nodo ginseng. So that's something to look into as well. Well, I'm sorry to say that we're running out of time, and I hope you enjoyed the show. Next week, we're going to continue this topic and talk more about the mechanisms of how chemotherapy cancer gets around chemotherapy. So have a very healthy and happy week. This is Dr. James Belanger, and this is the show Cancer Concepts and Complements. Tune in next Tuesday. Take care.
Thank you for joining us this week. Cancer Concepts and Complements with Dr. James Belanger can be heard live every Tuesday morning at 6 a.m. Pacific Time, 9 a.m. Eastern Time on the Voice America Health and Wellness Channel. We hope to see you next week for another show.